Hi, Dr. Lisa Vuich, Renew MediSpa. In this video, I'm going to review for you LED light therapy, which is a no-downtime procedure with many exciting clinical applications, including the treatment of acne, reduction of hyperpigmentation, such as from sun damage or melasma, collagen stimulation to prevent or treat wrinkles, acceleration of wound healing and even improvement in surgical scars and stretch marks, reduction of unwanted redness due to sensitive skin or rosacea, reduction of redness and swelling after aesthetic procedures, and there are even other applications for pain relief. I'll explain what LED light therapy is, how it works and how it was developed, which wavelengths are clinically effective and how they're selected, what you need to know if you're thinking of getting a home-use LED device, how to prepare for your session, and what to expect in terms of number of sessions and time to improvement, as well as how to maintain your results. We'll also review before and after photos and frequently asked questions. It turns out we've known about the benefits of high-intensity light therapy for a long time. In 1895, Danish physician Niels Ryberg Finsen was using concentrated beams of light to treat patients with lupus, and he won the Nobel Prize in 1903 for his studies on the application of light for the treatment of skin diseases. But they didn't understand how or why it worked, so it didn't go very far. In the 1980s, researchers were working with LED light in experiments funded by NASA to develop an LED plant growth unit that could be used to grow vegetables in the 1995 space shuttle. Interestingly, the NASA scientists who spent time with their hands under the light noticed that cuts on their hands seemed to be healing faster than usual. And since one problem astronauts face during space travel is slow wound healing, this motivated them to launch a series of studies evaluating the potential medical uses of LED. Their findings showed that high-intensity red and near-infrared light accelerated wound healing and sped up the growth of skin, muscle, and bone. LED devices were subsequently given to U.S. Navy crews to treat injuries sustained during training, and it was noted that they had 40% greater improvement and 50% faster healing times than those who did not use the devices. This research led to an FDA-approved device back in 2007. Fast forward to now, and we have literally thousands of studies exploring the potential benefits of LED light therapy across a broad range of conditions, and hundreds of them specific to the use of LED for a variety of skin concerns. LED stands for light-emitting diode, and LED devices are used to deliver low-level light therapy. Each LED has a semiconductor chip in it, which enables it to emit light of a specific wavelength, and it also has a reflective surface. Visible light is the only form of energy we can see, and the wavelength of the light will determine the color and the depth of penetration, and therefore what effect it's going to have on tissue. The three wavelengths for which there is the best evidence for clinical effect are 415 blue, 633 red, and 830 near infrared, which is colorless. 415 blue light is close to UV light on the light spectrum, but does not have its damaging effects. It penetrates only the upper layers of the skin, where it has strong antibacterial properties. It saturates the skin with oxygen, causing death of acne-causing bacteria. It also seems to have a mood-boosting effect. Red light targets the mitochondria, which are the powerhouse energy factories of each cell. This results in increased fuel for the cells so they can do their work more efficiently. Red light has been found to be helpful for skin health and rejuvenation, wound healing, and even hair growth. It can also be used to help remove unwanted pigmentation. Near-infrared 830 also activates the cells responsible for wound healing and facial rejuvenation. It penetrates more deeply than the 633 red and is able to reduce inflammation, boost blood flow, and kickstart collagen and elastin production by the fibroblasts. Okay, so we've talked some about proven wavelengths, but there are other key points you need to consider when choosing an LED device. Number 2 is that the light needs to be intense. In other words, devices need to have a certain amount of power in order to actually have clinical effect. Next, that light energy needs to be evenly distributed, which is really a quality control and design element of the device. It also needs high-quality LED chips. This is because cheap chips will degrade quickly. And finally, it needs adequate heat management. LED lights do generate heat, and if that heat is not appropriately managed by the device, again a design element, then the heat itself will degrade the chips. Now, If you go onto websites such as Amazon.com and you search LED for skin, you're going to come up with hundreds, if not thousands, of hits, and you're going to find a lot of cheap devices. Now, of course, there is a reason why these devices are so cheap. They're putting out unsupported wavelengths that haven't been proven useful in the literature. They have insufficient power generation. They even have impractical design, like these wands that you're supposed to roll around on your face. They seem to have no shame in posting obviously photoshopped before and after images. And most importantly, their LED chips are cheaply made. This is quite significant because, by definition, the home use device has to be used frequently in order to have even the hope of any clinical effect. And if you have one with cheap chips, and the more you use it, the faster the chips degrade, by the 50th time you're using this device, it's not functioning worth anything. So this is a serious problem. The Dermalux FlexMD device is a home use device made with very high quality, specially designed chips that do not degrade over time. They're also specially designed to be emitting most of the light at the desired wavelength, which is reflected by this narrow and high peak on the graph. That's what you want to see for best quality and results. Competitor devices have LED chips that are delivering less light at the goal wavelength, so there's more wasted power, and they also have less power overall. The TriWave-MD and the FlexMD are produced in Europe. The TriWave-MD is the highest powered LED device in the world, and it's for in-spa use. The FlexMD, as I mentioned, is a home use device based on the same technology. They have the same effective wavelengths as well as the highest quality LED chips available. The difference between the two is power and intensity of treatment. So let's watch a treatment being delivered. All right, so Victor is having the TriWave rejuvenation treatment now. Victor, how would you describe what the treatment is like right now?
Just feels warm, but nothing uncomfortable.
And the light is bright.
Yeah, the light is bright.
Yeah, but that light is light transmitted through the tissues. Victor is wearing eye protection, so none of the light that you sense during the treatment is anything dangerous for your retinas. And this is a 20-minute treatment. He's on skin rejuvenation protocol, so this is going to boost his collagen. It will boost his skin hydration. It will also reduce any inflammation if there were any breakouts that were about to happen, although this isn't the acne setting per se, but we do have specific settings for things like acne, eczema, and psoriasis, and we can also treat any body area. Do you feel a little bit of the breeze from the machine?
Yeah.
Yep. That's a ceramic cooling system so that the heat of the treatment is not at all uncomfortable. So what does a typical protocol look like? For moderate to severe acne, for example, a typical TriWave protocol would be to do twice-a-week sessions for 4 weeks, and then perhaps follow with a FlexMD at home, or periodic maintenance TriWave sessions in the medical spa, according to an individual client's needs. Active inflammatory conditions such as eczema or psoriasis can be treated initially with up to 3 sessions per week for 4 weeks, again followed perhaps with the FlexMD at home and or periodic TriWave sessions as needed. Here are some before and after photos of psoriasis being treated with Dermalux devices, of the hands and abdomen, and here of the extremities and the back. Excellent control has been achieved in merely 3 to 4 weeks. The FlexMD home device is used in the canopy position to treat the face or neck. Any other body area, it is used in the flat position and can be placed directly on the skin of the treatment zone. The FlexMD and TriWave in-house protocols utilize 2 or sometimes all 3 wavelengths for the treatment. The program will vary according to the condition being treated. Here you see a very nice result with acne using the compact light device. That's actually a device in between the FlexMD and the TriWave. It's not available for home use. But you see here results just as impressive using the FlexMD in only 12 sessions over the course of 6 weeks with no other treatment rendered. Here we see an injury treated with the FlexMD, just 6 sessions over 3 weeks with no other treatment, and really quite impressive healing. And the same here. Looks to be a traumatic injury, beautifully healed in 9 days with a total of 9 sessions daily using the FlexMD. and in this case a significant skin infection, was treated with the Wavelengths 4 sessions over the course of 2 weeks with no other treatment. 6 sessions of red light therapy over the course of 3 weeks with the compact light led to a nice improvement in this patient's melasma. In this case, a client with redness and irritation combined 7 sessions of FlexMD over the course of 5 weeks with 1 session of platelet-rich plasma and had a beautiful clearing of her skin. And here we have Wavelengths 7 sessions over the course of just 3 weeks with no other treatment and a dramatic improvement in this patient's fine lines and wrinkles around her eyes. LED therapy is safe for all skin types all year round. It does not sensitize you to the sun, and you can have it done if you have a tan. It's also considered safe for pregnancy, and it has no downtime, so you don't need to plan around special events. Preparing for your sessions is quite easy. The most important thing is that the skin be freshly cleansed. There should be no makeup, no lotions, and no sunscreen on the skin that's about to be treated. You may want to consider discontinuing products like Retin-A or retinol prior to treatment series, as using these products close to treatment time might cause you to be red a little bit longer than average post-treatment, but normally the post-treatment redness is gone in under an hour. You can simply continue your usual skincare regime, and you can apply makeup and sunscreen immediately post-treatment. We have several packages available to reduce pricing. A package of 6 sessions reduces the price per session to $99. 12 sessions brings it down to $89 per session, and 20 sessions would be $69 per session. A great use of 20 sessions could be that initial booster month of twice a week for 4 weeks, and then follow that with once a month maintenance with the Wavelengths. The FlexMD retails for $24.95. If you'd like to order one, just contact us and we'll let you know what our current available discounts are. Remember, the FlexMD is portable. It can be used by more than one member of a household, and it's a great device to use if you have recurrent or chronic pain conditions such as back pain or joint pain. We are so excited to be the first in New Hampshire and really one of the first in the country to bring the latest TriWave device to you and to give you access to the FlexMD for home use. If you have any further questions, please don't hesitate to call us at 603-931-4345.